Welcome back to another episode of the Heart of Local, where we highlight local providers doing amazing things in their community. And today I have with me Devin Salazar with WFMC Health. Welcome to the show, Devin.
Thanks, Tim.
So I'd love to know a little bit about your background and how you ended up at WFMC Health.
Sure. So I am a certified nurse midwife. I'm originally from the Seattle area and came down to Oregon for my training. Prior to WFMC Health, I worked at a local community hospital in Silverton for about 10 years, delivering babies and taking care of women in the community over there. In that time, actually offered centering pregnancy, which we're going to be talking about in a little bit, over there, which was where I was really introduced to it, and became a real advocate for it. And then through the course of the years and having young children, I decided to take a step back from doing deliveries and all the demands that put on my family, and was really fortunate to connect with an old colleague here at WFMC Health. And just through the course of some really lovely conversation about the clinic's needs and my needs, I was able to receive an offer to join the team about a year and a half ago, and have been here ever since.
That's great. So tell us a little bit about your role. You kind of alluded to it, but tell us about your role at WFMC.
Sure. So, as a certified nurse midwife, I provide prenatal care throughout a woman's pregnancy, starting from that very first prenatal visit up until it's time for her to go into labor and have her baby. I don't deliver babies anymore, but I do get to see women back postpartum for their kind of wrap up care for their pregnancy. I also provide the full spectrum of women's health care, that includes, care from the first period that a girl gets through kind of her adolescent and reproductive years. So that may include contraceptive care. It can include any kind of general issues that a woman may experience with her menstrual cycle, with infection, with pain. And then I also provide perimenopausal care. So women who are at the other end of the reproductive health journey, and really enjoy kind of providing that full spectrum of care for women in the community.
Right. Sounds like definitely a full spectrum. So, yeah, you mentioned centering pregnancy, and for those that aren't familiar with that term or that program, can you just kind of explain what that means?
Sure. So, centering pregnancy is a model of group care that's been around for a couple of decades here in this country. It replaces the traditional individual visit. Typically, when a woman or a birthing person is going through their pregnancy in the traditional model of care, they come and see their doctor or midwife, or other provider for maybe a 15 to 20-minute visit. It's very quick. We try to pack as much into those visits as we can, but you can imagine that it's pretty limited what we're able to do. So centering pregnancy really replaces that model of care. And instead of coming in for an individual appointment, women with similar due dates are put into a cohort together, and then they do group visits. Typically starting at some point during their second trimester and continuing on until everybody's had their babies. So it's unique in the sense that it's a group model. It's also unique in the sense that people get like an hour and a half to 2 hours each visit with their provider. Here at WFMC, it's myself and my colleague Kristen Jamsa, who are helping facilitate the groups alongside Sarah Wart, who is a community doula and our centering coordinator. So the centering pregnancy model still kind of follows the traditional schedule of prenatal care, of maybe seeing each other every month or so, and then in the third trimester having more frequent visits. But what really, I mean, there's many things that make it unique. Specifically having the time together, the length of time together, and the quality of the time. the centering model has a kind of a curriculum that we follow, not so much in the sense that it's a class. There is a lot of education and information, but in the sense that each group session has different topics that we go over. So we start off with kind of the common discomforts of pregnancy, and then as people journey closer to having their babies, we start talking a lot more about labor and childbirth and ways to manage the pain that comes along with that. We have a whole session dedicated to breastfeeding and lactation, newborn care. So it's a lot of information that women get.
So how many sessions are there in a cohort?
It depends, but typically about 8, sometimes 9. It depends on when people have their babies, and once we get down to maybe 2 participants left, we at that point switch over from doing group to just back to individual visits.
Sure. How do you think the group setting like really changes the versus the traditional model? I mean, what are some of the benefits of that group setting and the cohort?
Yeah, great question. From my perspective as a facilitator, and as somebody who's been doing this for a long time and seen kind of how COVID really impacted care and just the kind of this newer generation, younger generation of teens and women in their 20s. I see a lot more access to information, number one. A lot more sharing of information on social media, but also a lot more questioning of information of, oh, I heard this, but I don't really know if it's true, or, so and so said this, and I wonder if that might be true for me. So I see women having access to a lot more information than maybe a decade ago, but also a lot more, questioning of the quality of the information. I also see in general a lot more kind of stress and anxiety in women. And so I think one of the beautiful things of centering is that, in an age when people are very digitally connected, it's a way to really bring people into the present moment with each other in person rather than online. And then we get to really talk about that information that women already have and, how much truth there is to it and what might ring true for them and what might ring true for others. So that is just something that is so unique to the program that women obviously wouldn't get from just a 15 or 20-minute individual provider visit. It's also a real way to kind of to honor that time and to really help women start to carve out time to honor the process that their body's going throughout their pregnancy. Another thing that's special about the program is that partners are really welcome and encouraged to come if the woman or the birthing person has a partner and they're able to come. Otherwise, they can come by themselves or bring another support person. But for example, one of the cohorts I'm currently leading, a lot of the partners show up, and it's a really sweet and beautiful way to see partners come alongside the pregnant person and for them to both be equipped with really good information and preparation moving into the birth and even more importantly into parenting.
Yeah. I remember going through a couple classes when our kids were, I mean, when my wife was expecting, not to the extent I don't think that you're talking about with centering pregnancy, but it was definitely helpful for
Mm-hmm.
sure. I'm curious, like what kind of feedback do you get from the moms and partners, that go through the program, and what kind of feedback do you get from it?
Sure. Well, I think overall it's really positive. Um, Certainly heard from people like, oh, starting pregnancy, I wasn't sure about breastfeeding, but after, the breastfeeding session and learning from the lactation nurse that comes in to talk and just talking about how normal and healthy it is to breastfeed, I think I might actually want to give it a try. So that's one thing specifically I've heard from a recent participant. Other things that I've heard is, gosh, I just feel so much more prepared to go into this journey of childbirth and becoming a parent than I would have otherwise. I also hear that people have found good community, which I think folks are hungry for, but just in a different way now in 2026. And so I've heard from people coming away from that journey of like, wow, I'm staying in touch with my group members, and it's so fun to see our babies grow. We've Another thing that I think really speaks to the quality of the program is that we do have people come back. So maybe somebody goes through centering and completes the program during their first pregnancy, and they have another baby, they're pregnant again, and they're really excited to return to group. Not because, I think that there's each group is a new experience. So maybe they have a lot more wisdom and have, a lot of that education, but there's still more to learn. And it's still a really important time for people to carve out. So that's another really, I think, thing that is really affirming that we get feedback on from patients.
Mm-hmm.
Um, yeah.
You mentioned like breastfeeding and some of the support programs, because I think you guys have like after the baby is born, you have some additional support resources, including lactation and breastfeeding resources. Is that correct?
We do, yeah. So that's something that's pretty unique to the clinic now here in Salem. Historically, some of the other bigger pediatric practices in the community did have dedicated IBCLC trained lactation nurses. For various reasons, they're no longer offering those services in the community. And so our clinic is unique in that sense, at least here in Salem, as one of the bigger pediatric practices, that we do have a dedicated lactation nurse who is really our infant feeding specialist. People can access her services whether they're exclusively breastfeeding, whether they're exclusively pumping, maybe doing a combination of the two, needing to use formula. If a baby is struggling to gain weight, if a woman's working on her milk supply, or maybe she's wanting to go back to work and talking about how do I maintain this breastfeeding relationship I've worked so hard to establish while I'm at work on, doing a pumping schedule. So yes, after babies are born, they, as long as their babies become patients at our clinic, they get to have access to Meg and Rec. To our wonderful team of pediatricians and other pediatric providers. And then another special thing about centering once everybody has had their babies is we always do a reunion where women and their babies get to come back, and we get to hear about everyone's experience and meet all the newborns. Those are really very sweet, special times.
That's great. What do you personally love most about being part of this centering program?
A couple of things. I like that it's data driven. So, as a healthcare provider, I really want to know that what I'm offering is evidence based, and so there's a lot of really robust research by now. Now that centuring's been in use for so many years and in so many states, so that there's data behind it supporting its use. And showing improved outcomes for a lot of different measures. Some of those examples are women who go through the centering model. They're less likely to have preterm birth and to have low birth weight infants, less chance of NICU admissions, all of which affect the system costs, which is always something that's in the background. Women who go through also report, higher feelings of preparation and satisfaction with their experience through their pregnancy and birth, higher breastfeeding rates, and then also improved mental health outcomes as well. We know that postpartum mental health and that the spectrum of mental health disorders can be really challenging for a lot of women, and it seems that the support systems that develop through centering, both the group itself as a support system and then within each birthing person's life, become more robust and more protective for them. So I love that there is data to support the work that we're doing. And then on a personal note, I really enjoy it as a provider, doing 15 to 20-minute visits, which is the model of care that we're able to do most of the time, isn't very satisfying because I really like to be able to sit and get to know people and provide a lot of education and answer questions, which gets to be pretty limited when we have to rush through visits, especially if we have a stacked schedule. And so centering's really satisfying in the sense that, gosh, we get to provide a lot of information. We get to really clarify and add to the education that women already have. So for me, just on a personal note, I would say that's probably one of the biggest satisfiers.
That's great. And just tying it back to WFMC, I'm like, what's your favorite part of being part of the team there at WFMC Health?
Hmm. I really love the patient population that I get to see. I think there's, for a lot of the people and families I get to know, there's a lot of barriers that they face. There's a lot of challenges in life. It's a very challenging time, high stress. People sometimes struggle with transportation to get to visits, or, maybe with the current immigration situation, that can be a big barrier. And so I really love and honor the fact that people, like, it can take people a lot of work to come to the clinic, whether it's for centering or for an individual visit. And so just people being able to show up with the challenges that they have, I really appreciate and value. I also really value the team that I'm a part of here. It's by far the most diverse healthcare team I've been a part of since being in practice. And that goes from the provider level on down to our reception team. So it really feels like we're putting our money where our mouth is, in terms of, we serve a really racially and socioeconomically diverse patient population. And I think that's really reflected in the team here, which, yeah, I really appreciate.
That's great. Any last kind of final words about the centering program that you'd like to share?
I wish more people would sign up. And I think the way that I've noticed that we get buy-in from patients is sharing stories, and then women who've gone through it telling their sister, telling their cousin. That's often how we get referrals. I think often people are a little skeptical about maybe group care because they feel shy, or they feel like it might not work with their work schedule or childcare, different things. And we can make it work. We love people to try it out, and I would say the vast majority of the time people stick on with it and really, really enjoy themselves. So I just encourage people, when they are thinking about where they're choosing their prenatal care, to try us out. Come on over and see what centering is all about.
That's great. Well, thank you, Devin, for sharing the work that you're doing with the Centering Pregnancy Program and overall at WFMC Health. We appreciate all the care that you provide for our community. And thanks again for joining us.
Thanks, Tim.